Our next chair is Dr. Rabih Hammoud and co-chair Dr. Wsam Ghandourh to moderate this panel discussion.
Okay. Assalamu alaikum. Good afternoon. I know it's getting late, so we try to move on very quickly. So this is a panel discussion that's going to be focusing on one of the core pillars in cancer management, the medical physicist. So the title of the panel will be a global expertise and the regional impact. How can we build together the medical physics workforce? And we're going back to the word together that was presented by Dr. Matthias. So for this panel, we have two big organizations that are going to be sharing thoughts. And for that, I would like to invite the panelists. The first one, Dr. Andrew Maidment. Dr. Maidment, he's the current AAPM, American Association of Medical Physicists, president-elect. He's just started his 3-year career as president-elect. Dr. Maidment is a board-certified medical physicist and researcher at the University of Pennsylvania. He serves as the Chief of Physics of Radiology at the University Health System, and he is an Associate Professor of Radiology. Dr. Maidment developed the world's first practical digital mammography system in 1993, which was commercialized as the Fisher Sinoscan. Dr. Maidment has many publications, more than 160 research papers, and has multiple patents between pending and granted. Welcome, Dr. Maidment. The second panelist is Dr. Mohammad Hassan Kharita. He is the current president of the Middle East Federation of Organization of Medical Physicists, and he is a distinguished medical physics and radiation safety specialist with extensive experience in radiation protection, regulatory frameworks, and emergency preparedness. As acting executive director of medical physics under the Occupational Health and Safety Department at Hammoud Medical Corporation, he oversees medical physics and radiation safety across 16 hospitals in Qatar. He has served as an IAEA radiation safety consultant on over 40 missions and previously directed at the Atomic Energy Commission in Syria. Dr. Hassan has led numerous international education and training initiatives in radiation protection. Welcome, Dr. Hassan. To introduce, we would like to start with AAPM. The American Association of Medical Physicists has long established structured education, residency pathways, and accreditation and certification system that constantly support training quality and workforce readiness. The same in the Middle East, but at a lower level, comparable frameworks are still in their early stages, creating a timely opportunity now to learn from mature systems and models while building regionally adapted programs and strengthening accreditation routes. For this, I will start with the first question. Dr. Maidment, from your perspective, what defines a future-ready, high-quality medical physics training pathway? And what are the elements, the non-negotiable ones, not just for safe, independent practice today, but for practice in the next 10 to 15 years, please?
Okay, thank you. So that's a complicated question and many parts to it. So I'll pull it apart a little bit if I could. High quality, I think, is very easy to define. Quality is shown by the graduates of the program and their accomplishments. And to my feeling, you know, a program is high quality when its graduates do important things. And so I hold that more towards the outcomes of the program than the program itself. Future ready is more difficult because, predicting the future is almost impossible. I mean, right now we think AI is going to be dominating, but there are other things, flash, hypofractionation, ion beam therapy, things like that. So looking to that, what we're doing with the AAPM, I can tell you, is next week we're actually holding a summit to discuss these very things. We're trying to develop educational, scientific, and clinical pathways for these things. And I think what you need to do at this point is we need to become more dynamic in the way that we're teaching medical physics. Traditionally, like if I looked back 25 years ago, if in 2000, in the year 2000, you asked me, what would I be doing as a medical physicist in 2025? My vision would have been that I would be doing the same thing I was doing today. I would be doing it with newer CT scanners or newer MR scanners or newer LINACs, but more or less I'm doing the same thing and the same tools. I do not know that I have that same vision for 25 years hence. I do not know what I will be doing in 25 years, right? I will clearly be using AI in a very interactive way. But what we've experienced recently is that the pace of change is accelerating. And so what we need to build into our educational system, and this I know is going to touch on your next question to me, is we need to build in more dynamics. We need to build into more elasticity. We need to, bring new ideas in more quickly, and try to anticipate as best as possible the way to move forward. So you asked, what are the pillars of the non-negotiables? I think, they're the things that we're doing already. So high quality didactics, supervised clinical experiences with opportunities to get increased independence over time. And then, clear methods to assess how we're going and how we're doing, and to do continuing education after that.
Very good, very good. Thank you. Well, let me shift to the MEFOMP, to Dr. Hassan. If we start with this definition as a reference for us, what are the main challenges across the MEFOMP region, the Middle East region, in achieving this? Especially where services are expanding, but training capacity is getting more and more limited. Staffing and accreditation structures are also at the limited level.
Yeah, thank you very much, Dr. Rabih. And I'm representing here the MEFOMP. So I hope we'll not compare MEFOMP to AAPM. So this is
that's what we're learning from.
You're seeing the full spectrum, but we represent both ends in a way. So my point is the biggest challenge we have in the Middle East, that the diversity of resources, the diversity of infrastructure, the diversity of you find, for example, we have one survey which was published in 2021, and it shows that we have some country in the Middle East where 23 medical physicists per 1 million inhabitants, whereas some other country have half physicists per million. Equipment-wise as well, we have one of the resources-wise, we have the highest income countries in the world here in this region, and at the same time we have one of the lowest income countries. So when you have a regional program, then it's really, you have to take into account that this regional program has to take into account this diversity. So for example, equipment-wise as well, I could say that we have in one of the countries in the Middle East, we have the largest number of nuclear medicine equipment like PET-CT, PET-MR per million in the world. And some other countries have none. Yeah, we have as well educational-wise. This is an important issue. Educational-wise, we have half of the country have master's degree in medical physics, and the other half don't. So this is the diversity and the real challenge. So for me, I can say to reflect on the same question as Andrew already highlighted, we don't know exactly what's coming up, but we have to be back to basics. We have to address all the gaps, especially with the countries which need more help in the region. We have to collaborate. We have some bright bright points, like Her Highness today, she mentioned, like the cancer center, Hussein Cancer Center, as a resource center, already in the region. We have Hammoud Medical Corporation in Qatar. Both of them are identified as anchor center in the Rays of Hope. This is 2 out of 18 anchor center in the whole world. So our region is really resourced. So how we can access these resources is through the initiative of the IEA. This is really one important organization, the Rays of Hope, as May already mentioned today, the Rays of Hope, where we need equity, So as well mentioned, so the zip code does not affect where you live, does not affect. So you have this Rays of Hope you should have access to oncology treatment or cancer treatment wherever you are. So the anchor center will help spreading the training, spreading the education, spreading as well, even sometimes provide help and cure to some patient in some countries with no resources. So my point is really we have to rely on the experience of others, but we have to take another small challenge, sorry to keep going, that even the resource center, they have enough staff to run the show, but usually they don't have enough staff to train others. So we need resources for even these countries, say King Hussein Center in Jordan or Rabih Center in Qatar. They have enough physicists to run the show, but to train you need more. So this is for me, this is the main challenge.
Very good. Thank you, Dr. Hassan. Well, let me shift Dr. Maidment on other questions still within the same scope. The American Board of Radiology and the CAMPAP have played a major role in standardization, in standardizing the training quality in North America. Could you please briefly outline the current ABR CAMPAP pathway and what are the principles behind it? Further, which of these principles you believe are truly universal versus those that may need to be adapted for regions like the Middle East and Asia, please?
Okay. If I could just follow up with what you said very briefly. I feel that I have as much to learn from you as you have to learn from me. So, I think if you look at even within the United States, there's such a diversity of accessibility to healthcare that, there's a lot that we share in common. So to your question though, so just to everyone knows, CAMPEP is the Commission for the Accreditation of Medical Physics Education Programs. And it certifies master's programs, PhD programs, what are called certificate programs. Those are for people who have a terminal degree and want to enter the field into medical physics, as well as residency programs. There's approximately, I think, about 60 programs in the United States and about 20 programs outside the United States. The majority of those are based in Canada. About 15 programs are based in Canada, but there's 2 programs based in Ireland and 1 program based in Australia. So it is something that is relatively universally applicable and available. This CAMPEP, what it does is it basically establishes a curriculum, a base curriculum for these programs and tools for assessing the quality of those programs. And so what you do is every 5 years, you do what's called a self-study, which is you write a binder that's about this thick and you send it in, and then it's evaluated by educational experts in the CAMPEP program, and then they come and do site visits and evaluate your program. The ABR is the American Board of Radiology, and it is for where you get a certification for your subspecialization. So that could be in nuclear medicine, diagnostic radiology, or therapeutic radiation. That is a step that comes after CAMPEP, and it basically is testing your competence. And so it consists of 3 tests. Part 1 is a general physics and medical knowledge test. And that can be done after you finish your master's or your PhD. Part 2 is done after your residency. So after you've done your didactic training, you will do a hands-on training in a clinic for 2 years. And so part 2 is done after you've done that. And then part 3 is available usually the next year, and it's an oral examination. And for example, that will be held in about 6 weeks. And I'm actually one of the oral examiners for this year. How can it be used elsewhere?
Yeah.
I think, you know, if you look at like the International Commission for the Accreditation of Medical Physics Programs, I think I got the name slightly wrong, but the model is broadly applicable. I think what the real issue is recognizing each other's programs, right? There are mechanisms that you can and get ABR certified with a foreign degree, but it's not trivial. And I think what we really need to do is look at equity between programs and be more willing to recognize each other's programs. And so that would be the path forward.
I see. You know, because we're really facing this challenge here in the region. I think Saudi Arabia, they're doing, you know, I mean, some excellent job regarding this. The international accreditation through the IOMP is also supporting that. But we're also always facing this challenge. Do you connect with these international CAMPAP programs, and what can you learn from them?
So the AAPM has an international council. The AAPM is about a 10,000 member strong organization, and about 20% of the members are internationally based. And so about 5 or 6 years ago, we set up an international council. In fact, Dr. Huck was instrumental in having that created. And so we are working on programs to develop educational standards, educational materials, resources that can be used broadly across the world. Having spent yesterday in Abu Dhabi at Cleveland Clinic, the one thing I noticed is that right now, at least for the UAE, there's not everything needed to sort of go from, you know, an undergraduate degree in physics or engineering to being a board certified physicist.
Yeah.
And I think, you know, it's going to be this patchwork that we need to sort of fix.
I see. That's very good. Dr. Hassan, let me continue on the same topic. So across the region, training programs are available but remain limited. What efforts have been made so far to strengthen the structural training, and what are the 2 or 3 concrete action would say, if taken in the next 5 years, will definitely make a big change in the training landscape across the MEFOMP region?
Yeah, thank you very much. I should say that most of our physicists now are, you know, some of them are American board certified. So we used to rely on this certification for most of our physicists. This stopped after, you know, having needed residency in the state. So we had the ICMB, the International Medical Physics Certification Board. It was a good move in the right direction. In 2019, we invited them to Jordan, to Riyadh, Saudi Arabia, and to Doha, and we had some certification, you know, encourage people to have this certification. And this move was very good because certification is one thing, and having this authority to acknowledge this certification or accept the certification is another thing. So this exercise showed us that a lot of countries accepted this international certification, you know, but it wasn't the full solution. For us, we still supported different countries. So now we have in Saudi Arabia, they have a residency program. They established their residency program, and hopefully they will implement it in these coming years. In Iraq, there's one clinical center. They got the clinical accreditation from IOMB. So some expert came and said they looked at their clinical training for medical physicists. So these are 2 moves in the right direction. However, it's not enough. On the national level, we lack a residency program. We lack clinical training. This is very, and we need real help in this area. Talking regional as well, we can rely on some, you know, good places to support. I have one bright example in the past. The IEA, in 2007, they established medical physics for the region in the Jordanian University. It ran for 3 years. And a lot of physicists now, you can meet them in the different places, different countries, are graduates of this program. After that, it was followed by clinical training in Saudi Arabia. It wasn't in Jordan, so it was really tandem program. But unfortunately, it stopped for some reason, political or non-political, I don't know, financial could be. But that was really a pride. You know, sometimes you need, you have a common problem, but you could have a unified solution. A country like Qatar, for example, where I am working, to have a master program and clinical training for the country is not needed. It's not enough if you graduate every year 20 people, you will not find places to have work for them. So the regional solution might be the only doable solution. So we could accredit some places. So accreditate. So for me, the 2 or 3 points we should do is having regional center, regional resource center, as similar to King Hussein, Qatar, Hammoud Medical Corporation. It's not accredited already, it's already identified as, because they had, as the Dr. May said, they had Cambab and they had already Quattro, and already they had Quadrille evaluation to assess them as a regional center and anchor center. So these centers could help, provided that they have the support, the financial support, even to have more workforce to do training. This is one thing. Secondly, the master courses, which I already said 5 countries almost, or 6 countries have master program. Maybe we need to accredit this program. Only one program we accredited through MEFOMP, which is the newly opened master program, was in Yarmouk University in Jordan as well. So when they started the program, they asked us to review MEFOMP. So we reviewed against the standard of the IEA, and it was, good exercise. So accreditation of courses, developing of residency program, and then have some certification. So now the certification is by virtue of, okay, you have medical physics master, 2 years of experience, then you are medical physicist. That's only, so we don't have any exam, we don't have any real certification. So this is where we can rely on the experience of countries like AAPM and their experience with this. We don't have to invent the wheel again. We can learn from their experience and probably borrow some of their template and some of their experiences.
Dr. Ghandourh, maybe you got something to
touch on the issue of transferring models and learning from each other. And I'd like to ask both our panel experts, when transferring models from different regions, what elements do you think, in your opinion, that could be truly transferable? And what other elements that should or must be built locally?
Mm-hmm.
That's a tough one. I mean, there are certain fundamentals of what we do, right? The underlying physics, the modern physics that you have to learn, the interaction of radiation with biological tissue. These things are common across the world. But the feeling that I have is you need to adapt, especially the clinical portion, to that which is common to that country, right? It doesn't make sense to be doing a course on ion therapy if your country doesn't have that ability. You have to be sensible and practical about what it is that your physicists need to know. But I don't think you can shortchange their education. I don't think that this means that they shouldn't understand about ion therapy and carbon therapy and things like that, because those things will come eventually, and you want them to be prepared for those eventualities. But I think it's a matter of emphasis rather than a matter of like a difference in training. Physics is the same across the world, but how you use it's going to be very much country specific.
Would you like to add something to that?
Yes, I would like to touch on the same what you mentioned about the International Congress, which is established by AAPM, and that's how we were introduced to Saiful Haq when he was leading this international Congress, and so it was supposed to be the International Council in AAPM. It was supposed to help other countries, and initiate some, as as already mentioned by our colleague from Zurich, that ask a country for help. If you don't ask, they will offer. And we reached this stage where Saiful Haq and his international council reached us as MEFOMP, and we had some meeting, and it helped us to see more, although it did not establish real. We had 2 courses, one in Jordan as a result of this collaboration, and the conference which was in Beirut, if you remember. Yes. And recently as well, last year as well, the new leader of the international council, which is Robert Chiraj, right, yeah. As well, he got in touch with us and talking about shared strategic, let's say, strategic aims in medical physics. And we had a committee, shared committee now, so we have committee with members from us and them. Also, it was a round table with a lot of organization, but it was very effective. And hopefully we will build on that and get more support. But I think having collaboration is not just a word. It has to be, as you said, the end point. It has to provide something, and that's where I should like to touch on one of the points. They said research, and for me, collaboration will be strengthened by doing some common work, some research work, where you publish paper together and get more close to, a scientific group. And that could be not just in training, education, mentoring, and exposure to clinical, sites in the state, or, vice versa, have experts coming and visiting, etc. But I think research as well could be one valid issue to learn from it.
Right. Very briefly. So the International Council, as I said, was only formed about 5 years ago or 6 years ago. It is still in the process of finding its feet. They have activities in research and education and clinic, and they've almost basically set up like a little mirror of the AAPM for an international side. If you look at the AAPM over the years, we started with about 50 members in the 1954, I believe it was, or 52. Yeah. And now we have 10,000 members. Mm. But we're not going to grow that same amount in the next 10 years or whatever without more involvement of international physicists. So my vision for the AAPM is to try to grow the international representation of the AAPM. I would love to see the AAPM be 15,000 members and half of them be international. And I think that's a feeling that a lot of us share. And we're going to work towards that.
I got you. Wsam, anything before I go to the last question at the time? How can we, what's the advice, Dr. Andrew, that you will give it, a strategic piece of advice to the young medical physicists who are entering the field that will be shaped by AI? We saw a code that we might not have a job soon. So that by automation and workforce shortage, what's your advice?
So this is an easier question, because this is a question I've been asked many times. My advice to young people, to students, is not to be the specialist of one field. There are lots of physicists. There's a bunch in the room here, but there aren't so many that have physics and AI, or physics and computer science, or physics and business management, right? Be a multiple threat. Have multiple skills so that you're cross-pollinating ideas between fields, right? Bring something into the physics field that's not here already. And that's what I would recommend. And that, I think, is why we have to sort of rethink our educational pathways, because the entry points are so strict that we almost eliminate these people from opportunity, and we need to change that.
Sure. Dr. Hassan?
Yeah, I echo the same, but I think I'll get a quote, AI will replace medical physicists. No, I mean, according to the past AAPM president, who's Mahesh, he said only medical physicists with AI will replace medical physicists without AI. So the idea of medical physicists are irreplaceable so far. I don't think they will be replaced in any foreseen future, because they are the connection between the technology and the patient and the oncologist. So my point is, really keep up to date. You know, you have to show a difference between standard medical physicist, and you should show something extra, you know, like AI, IT, business management, leadership, things like this. Keep learning, because it's multidisciplinary. It's not just physics. You need to learn a lot of things to be able to swim as fast as others. And I think this is really a good advice for physicists.
Well, Dr. Wsam, anything to add from your side before we conclude?
I would just like to end by thanking both panel experts. It was really insightful to have the perspective from established healthcare systems like the US and from the region where health services are rapidly growing. So it was very engaging to have that discussion. And I would like to thank you both for being here today.
Dr. Andrew, Dr. Hassan, thank you so much.
Thank you very much.
Yes.
Thank you very much.